Hi everybody, welcome back to my channel. Today I'm going to go over on ways to prepare for a hospital rotation as a P4 year, and specifically for APPE institutional hospital rotation as I'm a preceptor. Many of you who are starting my rotation tend to ask questions, so I thought it'd be good just to do a video and cover, and also have Tommy.
Hello everyone.
My current student right now, so he can kind of share some insights with you on how to prepare for the rotation. With that, I'm just going to go over some ground rules and things just to start out, and then I'm going to have Tommy talk about some of his tips and tricks that he learned throughout. This is his 5th week, so he's really an expert at this point on this rotation. First things first, I would always appreciate when students send me 2 weeks in advance an email with your CV as well as your career goals, because that also helped me to understand what you're looking forward to and what you'll be doing, as well as your experiences that you have had. I really try to tailor and customize the rotations to your experience as well as your career goals. So that's the first things first. And then I also send out like a syllabus of like where to meet in the morning, because on our first day we'll be meeting and talking about the syllabus, orientation, my expectations overall, and just trying to get you kind of the logistical issues that you need. So that's pretty much a quick information on that. I'm gonna go over to Tommy today just so he can share with you some more tips and tricks.
All right, yeah, what Ann said, that's true. Do what Ann said, and that's the first part of being successful at your rotation. But with my first tip I'm gonna give, it kind of goes with any rotation, and I'm gonna call it planning your route. And what I mean by that is you want to know how you're going to get to your hospital site. Take a look at the traffic that's estimated at that time. It's probably your first time ever going to that hospital, so you don't know the way around. Oftentimes you might find orientation might be in a different building than the pharmacy, and you want to make sure you know where that is, just because it's the most important thing is you don't want to be late. Being late just makes you look bad. Yeah, on the first day, I would say you want to plan to be there extra early. You rather be waiting on them than have them waiting on you. So especially for the first day, come super early. The whole first week, come early until you get used to it. Maybe starting toward the second week, now that you're adjusted, you know how much time you need to get there. But yeah, make sure you know your route when you're coming here to the hospital.
And one more thing to that is that most pharmacy, when you're doing a hospital rotation, the pharmacy tends to locate in a secret spot, either a basement or somewhere that is not clearly labeled. So I absolutely agree of coming here early. So for me, my rotation on the first day, I have students start at 8 a.m. So I'll meet them 8 a.m. in the lobby, but you're here at 7:30 or 7:45, even better. Sometimes I have someone that come and help me to find the student. So the earlier you're here, not too early, you're not really here at 7 or 6 if you're scheduled to be here at 8. So just make sure you keep that in mind.
Yeah. All right, and the next tip I'm gonna give, I'm gonna call it stock your coat with the tools for success. And by that, what I'm talking about is you need tools to be successful here at the hospital. And with tools, I'm talking about bring yourself your pen and your notepad. Those two are like my key tools to success, in other words. And the reason being is, even on orientation, there'll be a lot of talking. They'll tell you all this important information, and you need to write that down. And not just that, once you start getting into the meat of the rotation, you'll start getting projects, assignments. And for each of these projects and assignments, they want different things, different details that you need to add that they don't want you to forget. And if they keep building up upon all these details, you're going to start forgetting it, and you just want to write it down. The worst part is giving a presentation and you forgot the most important part that they asked for. So make sure you write stuff down. And not just that, you'll often learn interesting things or important things that you should write down so that you can remember. And having that notepad and pen on hand just gives you the ability to do that.
Right, and if you're not a notepad or pen person, just using it as a writing tool. So I know most students nowadays use their phone religiously, and that's fine. That's one of the things that you want to communicate with your preceptor. It's acceptable to use it to look up drug information questions like lexicon, clinical pharmacology, micromedics, or use it as a note-taking tool. But you just don't want to communicate that to your preceptor so he or she doesn't take it that I'm talking to you and she may think that, oh, on Facebook or Instagram. So communication is key, and as long as you use that phone for professional use, it's appropriate, but you just have to communicate, especially when you are doing discharge counseling, when you're in a patient room, of course, trying to refrain from using the phone. Or if you do have to use a phone, either a phone call from family, go ahead and excuse yourself, be like, sorry, I have to take this call, and then walk outside and find a private area to use it. Again, you have to show and be there every day of the rotation is like an interview, so you want to do your best and show your best self.
Yeah, I agree with that. And then for the third tip, it's going to be come ready to work. And what that means is the rotations is not going to be easy. It's not a breeze in the park. You're going to be expected to work, do things that you're not used to doing. And you need to come in with that mindset that you will be worked. And so oftentimes you're thinking, oh, I'm in pharmacy school. That means I'm only going to do pharmacist work. That's not true. And you shouldn't think like that. Oftentimes you'll see in the hospital that they'll have you do technician work. You might be refilling the Pyxes. You might be pulling meds from the carousel. You might be restocking the meds. And you may think it's very pointless, but that's not true at all. Part of pharmacy is understanding the whole workflow of the pharmacy. And that includes the pharmacist work and even the technician work. And not just that, you might want to learn what the buyer does, what the Pyxes manager does. Everything put together is what forms the pharmacy. So if you only know the pharmacist work, then you only know a part of it, a part of the whole workflow, and that's not going to set you up for a good future. So whenever they have you do these dumb sounding tasks, they're not that dumb. Just be prepared to do stuff like that.
Absolutely. And when students go on my rotations, depending on your experience, hospital or technician experience in the retail side, I usually give you at least 1 to 2 up to 3 weeks with the technician. And it's so important to understand that, because this is probably your last opportunity to have that technician work experience, knowing their workflow. And I used to work as a hospital technician, and now where I'm at, it really it allows you to appreciate their workflow even more and all the work they put in. Pharmacy technicians are a crucial part of pharmacy, and being a pharmacist, you're in virtue their supervisors, but you're not going to be an efficient supervisors if you don't know what your pharmacy technicians do on day in, day out, and the struggle they have, and what are some of the things that you can help them as a pharmacist. So for me, it's one of the expectation that regardless you have working experience or not, I'm still going to put you in with our technicians, because you can learn from everyone, and everybody will show you something different, even if you have hospital experience, because every hospital, again, is different. So it's definitely not pointless. It's really allowing you to have a holistic experience on the hospital experience for pharmacy.
Yeah. The next thing I'm going to say is definitely you want to interact with the staff. I find that's really key to making your rotation not only fun, but it just lets time go by faster. You don't want to be the person that just sits in the corner all day on the computer and does their work. It honestly makes you look kind of boring, makes you look bad as a person, because I don't know, you're not interacting with anyone. So definitely, as you're working with the technicians, get to know the technician, find out a little bit more about them. Even when you're shadowing the pharmacist, talk to them. And you don't have to just be working with them. If you see they're having lunch and they don't mind you joining, you can have lunch with them as well. Just have small talk, get involved, get to know more about them. They honestly probably want to know more about you too. And by talking with them, you'll see that time goes by much faster, because you're enjoying your time here at the rotation rather than just sitting there all day.
And I can't agree more. And with the student that come with me, I really challenge the next level, right? I want to learn about you. I want to get to know who you are, what you do, what your interests are, your career goals. Because in the end, think of this as an interview. Especially if you're like, oh, I already have a job, or I'm interested in retail only, I don't really care about hospital. That's a wrong mindset to have, because you never know what's going to happen in life and when you cross each other again. Because pharmacy is a very small world, and you don't want to burn any bridges. So being here and being even sometimes hospital rotation may be easy. Again, it's not. It's what you put into it is what you're gonna get out of it, and that's one thing I tell all my students and all the those that are wanting to do a residency or don't want to do a resident or just want to go out there and get a community job or just get a staffing job. Regardless of what you want to do, having a rotation, show up, be professional, and do your best every day carries a lot of weight, because I have to spend, I spend with you 6 weeks. So I really get to know you in and out. And when someone see my name and that person may be my friend who's hiring you, they may call me like, hey, what do you think about Tommy? So really, don't burn any bridges. Don't do anything that you wouldn't do on an interview that you would do on a rotation. Like, don't take a nap during lunch, or just showing unprofessional behaviors, or chewing gum while talking to patient. Things that you may think is common sense, but may not be common practice. So keep that in mind, because again, pharmacy is such a small world.
Yeah, I agree with that. And for my last tip, I'm gonna say is that you do want to ask questions. Asking questions is a way for you to expand your knowledge. The thing is, a lot of time when you're shadowing pharmacists or shadowing techs, sometimes they don't know what to say to you or what to teach you, because they do this every day. So they kind of get so used to it that they feel like you might already know how to do this. They think it's just common sense, but you might be new to the system. You might not know how certain technology works, and it's perfectly fine to ask questions. The thing is to remember is you are the future of pharmacy. As a student, we're gonna become pharmacists soon, and then we're gonna be in their shoes one day. And when you ask questions to other pharmacists, they tend to be more than eager to help you, because they're trying to shape you to be a better person, a better pharmacist, as we want to continue growing our profession.
Yes, and sometimes where students say, well, it's really boring just sitting here next to a pharmacist for like 4 hours. Again, it's what you put into it, right? What you put into it, you'll get out of it. So if it is a slow day, that's great. It's opportunity to ask them about their work experience. Most of the pharmacists go through in the hospital, they've been here for at least a few years, or at least out in practice, or been in other facilities. So this is your opportunity to ask questions, to learn from them, things they wish they could have done earlier. So, and then of course, when things are a little bit slower, you can ask them. Of course, it depends on their comfort level. Hey, can I take the driver's seat and verify the orders, and just talk through what are some process you're thinking. Like Tommy said, they do this day in, day out. They probably, when they do a vancomycin order, they already know what to look for, where to look for things, especially is a new electronic health record, things like that may be completely new to you. So just say and ask them. Of course, you got to build that trust, build that credibility for them to say, okay, you can handle this. And say, can I take their driver's seat? Let me just kind of go through the order. So you're in the driver's seat. Again, I can't emphasize it enough that what you put in is what you get out, and the amount of attention that you put in with each person that you're shadowing is really the result that you'll be able to get out of it.
Yeah.
So I hope that was helpful in how to prepare for hospital rotations. Most hospital rotations are very similar, depending on the size of the hospital. Community versus medical center versus, like I'm trying to think what other hospital setting are there. Long-term care facilities, etc. So you may experience different settings, but in terms of the general consensus and general experience is very similar. It really depends on what you want to do. And then on hospital rotation, this is an opportunity for you to ask if you can shadow other clinical pharmacists, if they're time allowed. If you want to go see a surgery, this would also be a great time for you to do so. If you want to shadow a case manager, respiratory therapist, anyone that you felt, I'm curious, what do they do and what's their contribution, or PN or physical therapist. in the institutional API hospital rotation, this is the opportunity for you just explore while you're still learning, because when you become a pharmacist, it's really hard for you to go and shadow everybody around the hospital and getting to know like the pharmacy workflow, but also like the hospital operations. I hope you find this helpful. If there's any other comments or questions you have, please post it below. Subscribe to my channel for upcoming videos, and have a great day.
Thank
Bye,
you.
guys.
Bye.
Thank you.